Okay, so some COVID testing questions came in through social media, and so I thought I would add them to our discussion today, and we may or may not have the answers, but I just thought they were some very interesting questions. So it was asked how many positive cases are retests for the same person? And are
So,
those numbers counted in the overall numbers?
according to the county, they're not, because there are patients do get retested, and some frequently. That's been the novel, part of this virus is it's so unpredictable, and there was, no literature, no data that we could look to help us understand how it would behave. So we have patients that test negative, but then a few days later might start exhibiting some change in their health status, and might see a slight rise in their temperature. So we test them again, and they test positive. And then you're going, so maybe wait a few days and test them again, and they still might be positive. So there's that kind of testing that is going on that results in repeat tests of the same patient. Then also all nursing homes, patients will not be permitted to go back to their nursing home until they've tested negative for COVID. And that's not just patients that were positive for COVID and got admitted to Kaweah Delta and successfully overcame the disease, and then now they're negative. So if they were positive before, we have to test them, and they have to be tested negative before they can go to a nursing home. What's really interesting, though, is you could be completely recovered from the virus, and there are dead virus cells still in your bloodstream. They will test positive, even though you are no longer contagious. We've had patients that are testing positive 30, 40, 40 days, 2 months after they, were admitted and completely cured. But they're still testing positive. But they're not contagious. But that's a discovery we've had over the last couple of weeks. So that causes the multiple testing, because we keep testing, waiting for that negative.
Right.
And maybe it finally comes. But a lot of retesting does occur. Thank you for you did some research for me. So
I did.
Apparently, we've done 268 retests. I'm actually surprised. I think it would have been higher than that. Again, particularly because of nursing homes are starting to take their patients back, but again, they won't take them back unless they test negative. So even patients that were transferred from a nursing home to Kaweah Delta for something completely unrelated to COVID, they never had COVID, we still have to test them before the nursing home will take them back.